Welcome back to our channel. Today, we have an important topic to discuss: childbirth methods. Specifically, we'll be comparing cesarean section, C-section, and vaginal delivery, highlighting their differences and considerations. Let's dive in. Let's talk about the method of delivery. In a C-section, the baby is delivered through a surgical incision made in the mother's abdomen and uterus. On the other hand, vaginal delivery occurs naturally through the birth canal. Method of delivery. 1. C-section. The baby is delivered through a surgical incision made in the mother's abdomen and uterus. 2. Vaginal delivery. The baby is delivered through the birth canal, vagina. Indication. 1. C-section. It may be planned, elective, or performed as an emergency procedure due to various reasons such as fetal distress, breech presentation, placenta previa, previous C-section, or maternal health concerns. 2. Vaginal delivery. It is the natural process of childbirth and is the preferred method when there are no complications or risks that necessitate a C-section. Surgical intervention. 1. C-section. It is a surgical procedure that involves anesthesia, an incision in the abdomen and uterus, and the use of surgical instruments. 2. Vaginal delivery. It is a natural process that does not involve surgical intervention, although medical interventions such as epidural anesthesia or episiotomy may be used if necessary. Recovery time. 1. C-section. The recovery period is generally longer and more involved compared to vaginal delivery. 1. The mother may experience pain, discomfort, and limited mobility for several weeks after the surgery. 2. Vaginal delivery. The recovery period is usually shorter and less intense compared to a C-section. 2. The mother may experience soreness and discomfort in the perineal area, but it typically resolves relatively quickly. Risks and complications. 1. C-section. It carries risks associated with surgery, such as infection, bleeding, blood clots, and adverse reactions to anesthesia. 1. There is also a possibility of complications in future pregnancies, such as placenta previa or uterine rupture. 2. Vaginal delivery. While generally considered safer, vaginal delivery can still have complications, such as perineal tears, episiotomy, or postpartum hemorrhage. 2. However, these risks are generally lower compared to a C-section. Breastfeeding initiation. 1. C-section. It may slightly delay the initiation of breastfeeding due to the surgical recovery process and potential separation of the mother and baby immediately after birth. 2. Vaginal delivery. It allows for immediate skin-to-skin contact between the mother and baby, facilitating early breastfeeding initiation. Future pregnancy. 1. C-section. Multiple C-sections may increase the risk of complications in future pregnancies, and vaginal birth after a C-section, VBAC, may not always be an option. 2. Vaginal delivery. Having a vaginal delivery does not usually impact future pregnancies, and VBAC is often a viable option for subsequent deliveries. It's important to note that the method of delivery is determined by the healthcare provider based on individual circumstances, the health of the mother and baby, and any potential risks or complications. The most appropriate method will vary from case to case, and it is essential to consult with a healthcare professional for personalized advice and guidance.